This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Let's talk again about choosing a drug plan. Medicare Part D, the most complicated part of Medicare out there. A lot of people readily admit that they don't understand it. Some people say, oh yeah, I know it and I don't need your help. And that's okay with me. But I was in the process of moving a client that I've had for several years from one carrier to another, which requires underwriting. I know some people think because it's open enrollment that you can always change your Medicare supplement plan. No health questions asked. Well, it doesn't work that way. You can move your Medicare supplement plan anytime you want to because underwriting is required. One of the things that I need to evaluate whether or not you're even going to qualify is a list of your current medications. Well, this is a client that, as I said, I've had for 4 or maybe 5 years, and I had always offered to update their drug plan. They never took me up on it, and so I thought, okay, well, I've got your current drugs. I'll just go ahead and run a report now and send it over. So I did. And I do a narrative and tell them, this is the plan that I would suggest. This is the premium. This is your projected annual cost and so forth. And I attach some Medicare reports to it, making it hopefully very simple to understand. Well, I did that, and this particular individual fired back an email and said, I don't need your help. I have already done my own analysis of drug plans. And I thought, okay. But I did appreciate you telling us that we could get Synthroid through a Canadian drug company for about 20% of what we're paying through our plan. So I'm thinking, okay, so you really did need my help. You just decided that you didn't want to take my advice on the other stuff, and that's fine. You never know what's going on with people, but that's just one of the things that a lot of people overlook. They always think I'm going to look at my plan and I'm going to use this pharmacy that I've always used for years. And I've always had this medication, and my copay last year was $10, and I guess my copay next year will be $10, and so that's just it. Nobody wants to fool with it. Well, I do. Not because I'm a glutton for punishment, but I do because I know that even though I may have a situation where I can save you $10 or $20 or $30 a month on your Medicare supplement plan, a lot of times, if you're taking any medication at all, sometimes I can save you $40, $80, $100 a month or more by making a change in your drug plan, which does not require underwriting, unlike changing your supplement plan. So I had another situation, a lady that last year was on about 8 different medications. This year she's up to 14. And last year I must have done 6 or 8 or 10 different revisions as she was trying to figure out which way she wanted to go. And I didn't really have the time, but I took the time last year to do it. This year she sent me a list of her medications, and I reviewed them, and I sent them over there, and I said, I want you to look at this list before I crank it all the way through the formula. I want you to look at this list and make sure that this is exactly the way you want it, because as it stands right now, your monthly cost is going to be several $100s. And I broke it out for her. And she came back and she said, well, I can't afford that. And I said, well, that's why I wanted to find out, do you really want all of these drugs to be covered under your Part D plan or not? And we talked a little bit, and I explained to her how this thing works, and she says, okay. she said, I'll revise this and get back to you. And I said, well, give me the final revision because I'm really, really busy this year and it's late in the open enrollment period. And so I need to know exactly which medications you're going to run through the drug plan and which ones you're not. And okay, and that was 2 weeks ago, maybe 3 weeks ago. As I said, today is the last day of open enrollment. And this morning, she sends me her list. She says, look over these plans. I've crossed out the ones that are too expensive and tell me which ones you think I should consider. I looked at her report, and what she had done, she got this off of Medicare.gov, is she had the names of all 26 plans out there, the premium, what the deductible was, if there was a deductible, and what the co-pays were, anywhere from 0 to 50%, by each plan. And she'd made notations on there. This plan looks good. This one does not. I can't afford that one, and so forth. But she hadn't included the drugs, which means the information that she had done and all this analysis, and I don't know how long she spent doing this, but the analysis she did was basically useless. This is, I cook. Not a well-known thing, but it's a relaxation for me, and so I do all the cooking here at the house. And I usually follow at least part of the recipe. I like to add things and subtract things, and kind of change them around a little bit, which means I can cook you the same meal twice, and it's never going to taste the same. But I know how to use a recipe, and if you had a recipe that said, all right, make some stew, first buy meat, and that's it. If you didn't know what type of meat you wanted or the recipe called for, if you didn't know how much meat, it really wouldn't be very helpful. It wouldn't be a very helpful recipe. And it's the same thing in evaluating drug plans. You have to look, actually, I don't even look at the premium or the deductible or anything else. All I look at is the total cost, which is premium plus copays. But the premium by itself really doesn't matter because in some situations, some medications, if you buy a higher premium plan, you're going to get a much lower cost, a much lower copay. So, but I don't rank plans from the lowest premium to the highest premium because it really means nothing unless you've got the ingredients, in this case, the prescription drugs. So I explained to her that this is not helpful. There's nothing I can do with this because unless I know which drugs are going into this formula, I can't make a comparison. The Medicare.gov only allows you to compare 3 plans side by side and only 2 pharmacies. So unless you've got a pretty good idea going in, at least which pharmacies you're going to use and certainly which medications you want to run through the drug plan, it's meaningless. And I said, I hate to do this to you. This is the last day of open enrollment. But I got to have this by 4 o'clock if you want me to run a current report that's meaningful, because I can't do anything with this. Well, we'll see where that goes. It's 3:30 now, and I haven't seen it, so I don't know. But the bottom line to this is sometimes if you want to run your own drug reports, there's things that you may not know to look for, such as, can I get this medication cheaper through a Canadian pharmacy, or if it's generic, I might be able to get it cheaper using GoodRx as opposed to running it through any drug plan. There's certain things that you may not know to do or you may not consider doing. And the other thing is just looking at the plan specifics and which one has, what the copay range is and whether or not it's got a deductible really just does not, is a non-issue if you're trying to find the lowest cost. So, this is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.